Here in the Ozarks, it's the end of August, and we have Goldenrod in full bloom. So we're going to use the Herbal Database to learn more about it, starting with the medicinal plants menu to look it up. There are different ways to find it, but I want you to see how to use this menu. Now, Solidago is the genus, and this is organized by genus. So let's scroll down to the S's, and there we go. Solidago canadensis, goldenrod. Click on that. So over on the right, we've got some tags up here. Goldenrod is tagged as anti-carcinogenic. It grows in Arkansas. By the way, all of the plants that grow in Arkansas are tagged this way. And if you were to click on that link, you would pull up all of the plants that grow in Arkansas. It's astringent, cool, decongesting, diuretic, dry, grows in the Ozarks, restoring, stimulant, and stimulating. Some links here, we'll skip that. Now some people mistake goldenrod for ragweed, so be careful with your identification. It's ragweed that causes allergies, goldenrod does not. It's always a good idea to take a look at the genus of any plant that you're studying, because there are many species in a genus. Some of them are medicinal, some are not. In the case of goldenrod, we have approximately 400 different species. And the question is, are they all interchangeable? Does it matter? Now, Solidago canadensis and Solidago odora are the two most widely recognized, studied, and used species of goldenrod. But identifying them is very tricky, and you'll see why in a moment. But let's go ahead and click on the genus and see what we can learn. As you can see on the left, these are all of the species of goldenrod that I've added to this database. And surely we're not going to try to put all 400 in here. But the question is, what do they have in common with each other? Does it really matter if you are able to identify which species you're working with? And it's in the genus that we're going to learn more about what they have in common. So I always add good videos to help you with identifying and learning about the genus. But I'm going to skip down here, and we're going to talk about what all of the species of goldenrod have in common. So first of all, let's talk about edible parts. All of the aerial parts of the plant can be used. The flowers are edible, and they make attractive garnishes on salads. The flowers and leaves, fresh or dried, are used to make tea. Leaves can be cooked like spinach or added to soups, stews, or casseroles. Take them when they're young. They get kind of leathery as they get older. Leaves can be blanched and frozen for later use in soups, stews, or stir-fry throughout the winter or spring. Now, what we know in ethnobotany is in Alabama, the tribes used it for bad colds. They made a tea from the roots, and they also used it for toothaches. The roots were put into a cavity to relieve a toothache. So goldenrod is an astringent, and when you use it in an infusion, it's diaphoretic. It will open the pores and move circulation outwards to relieve fevers. The astringent properties are useful for toothaches, and of course the diaphoretic properties help dispel a cold. Now here we're going to dig into medicinal properties shared by all Solidago species. So they share several key medicinal properties, most notably anti-inflammatory, diuretic, antimicrobial, especially antibacterial, so they're good for wounds, analgesic, that means relieving pain, and spasmolytic. They have a common phytochemical profile and historical ethno-medicinal use. So let's dig into this a little bit. As far as their anti-inflammatory effects go, it's pretty strong, and that's linked to their flavonoids, like quercetin and camphorol derivatives. We'll get more into the constituents later. It's helpful to know the constituents in order to understand what it is that you want to extract. So these flavonoids are going to be extracted in water, meaning you're going to get them in your teas. And so diuretic, all Solidago species are renowned for their diuretic properties. They stimulate urine flow and are used in urological remedies for conditions like cystitis, bladder inflammation, and kidney stones. And the effects of that are attributed to leocarpicide and various flavonoids. And they are antimicrobial. They contribute broad-spectrum antimicrobial effects, inhibiting bacteria and fungi. That's valuable in urinary tract infection treatment and wound care. And by the way, mouth washes can be useful in oral candida or thrush. They're all analgesic and spasmolytic, so they help reduce pain and smooth muscle spasms, supporting their use for urinary, joint, such as gout and arthritis, and digestive complaints. Now, when we talk about digestive complaints, it's really sweet goldenrod, Solidago odora, that's preferred. And they're antioxidants. So many plants are antioxidants. Most species are rich in flavonoids and other phenolic compounds that act as antioxidants, protecting cells from oxidative damage. Astringent and wound healing. Solidago's tannins and saponins contribute to mild astringent properties, supporting wound treatment and mucosal tissue integrity. And here we have a list of some of the bioactive compounds that they share. All of these are hyperlinked, so you can click on them to find out more about them. I'm not going to do that right now. But let's go back to Solidago candensis and Solidago odora. There's some videos here that you can use to learn how to identify it. I'm going to scroll down. By the way, this explains how useful goldenrod, especially this Canadian goldenrod, which is Solidago canadensis, is for erosion control. Here we have a list of the qualities, properties, tropisms, and the ground. We really dig into the constituents in this section. According to the European Pharmacopoeia, when products are made from goldenrod that are sold on the market, they tend to be standardized based on their flavonoid content, requiring a minimum of 0.5% and a maximum of 1.5%, calculated as hypericide, which means hypericide is one of the more important constituents in this plant. Now remember, the constituents in a plant are going to vary, not only among the species, but where they're growing, the time of year that they are harvested, and so on. We see that the raw material is also rich in polyphenolic acids. I'm going to encourage you to, if you really want to understand this plant, to dig into the constituents. Let's look over on the left-hand side for a moment, and some of the main phytochemicals are shown here. Everything's color-coded, and the phytochemicals are going to be this purple color. For example, camphorol is in all of them, and goldenrod, especially the canadensis species, is going to have quite a bit of it. Let's just take a quick look to see what all camphorol does. This helps you determine what it is you really want to extract. And most folks, when they learn about Camphorol, they're going to go, yeah, we want to extract that. So here are the tags: anti-inflammatory, it's a cardiotonic, it protects the liver, and it protects the nerves. So here's an explanation and some videos. But just check out all of the research that's been done on this one constituent that we find in goldenrod. Effects on things like cancer, cellular repair, diabetes, the eyes, the immune system, and so that's an important one. And we see that it's also in ginkgo, broccoli, cabbage, endive. Let's just go back to goldenrod here. Now, in terms of uses, the German Commission E, many of you will know what that is. In Germany, they are still big on the use of herbal medicine, and they have something called the Commission E, which does thorough research to determine what you can actually count on an herb to do. So they're saying that yes, you can count on goldenrod to treat infections of the urinary tract and kidney and bladder stones. It's used as a flushing out therapy for inflammatory diseases of the lower urinary tract. Very soothing and healing. A useful diuretic for urinary tract problems, obstructions, kidney stones, and inflammation. I think it would be nice mixed with marshmallow. Helpful for hay fever and allergies to cats. It can be helpful for upper respiratory infections and yeast infections like thrush. Topically, you can use it for sore muscles. The phytotherapeutic uses of Canadian goldenrod include the treatment of chronic nephritis, cystitis, urolithiasis, which is stones, and rheumatism. It's used for anti-inflammatory applications, again, as a mouth rinse for oral and throat inflammations. Now, you see those R's, those are the references that this comes from, and you can click on it to read the study. It promotes urination, drains fluid congestion, relieves edema, resolves toxicosis, and benefits the skin, nourishes, and restores kidneys. Now, this database combines Western and Eastern herbal medicine, including Chinese, Ayurveda, and even the most contemporary uses of herbs. So here we're getting into a bit of the Chinese use, something called kidney fluid congestion. In Chinese medicine, that condition has certain symptoms like swollen ankles and legs, spreading upwards, puffy eyes in the morning, lumbar pain, edema, so on and so forth. During acute nephritis, this can be useful. And something called kidney cheese stagnation with metabolic toxicosis. And here are some of the symptoms of that. It's good for chronic skin conditions like dermatitis, psoriasis, eczema, acne, herpes, through its action on the kidney cheese. Here's more on its anti-inflammatory and antimicrobial activity. And so we see that it can reduce inflammation, particularly in the kidneys, liver, and other organs. It inhibits the COX enzyme. Saponins and phenolic glycosides have different antimicrobial effects against common pathogens that are responsible for urinary and skin infections. That brings us to skin and wound healing. Use topical preparations for purulent wounds, furunculosis, gum abscesses, skin diseases. Can be used as a mouthwash. So that keeps coming up, doesn't it? Especially Candida species. Use it as a wash and compress for healing wounds, gum abscesses, and furuncles. It is hepatoprotective. The extracts, particularly those in ethanol, have shown moderate liver protective activity in preclinical models. Its efficacy is somewhat lower than classic hepatoprotective drugs. Now, oftentimes when you read about drugs in reference to herbal medicine, in the old days, herbal medicines were called drugs. Let's get that out of the way. Evidence supporting the hepatoprotective effects comes primarily from controlled animal studies and pharmacological analysis. Extracts prepared from the herb, especially with 40% ethanol, have shown moderate hepatoprotective activity in models of acute liver toxic injury in rats. Okay, and here we see, I'm not going to go through all of this. I invite you to subscribe to the Herbal Database so you can dig into this further. I'm trying to make this a short video. Here's experimental evidence in animal models. Here are the phytochemical mechanisms. And here's some other applications. Allergies and colds. It does have immunomodulatory effects. Rheumatism and arthritis. It's reported to be anti-hypertensive, anti-diabetic. Here's more on the edibility. The shoots and young growing tips are a vegetable you can harvest in decent quantity, eat and enjoy, if you can take some strong flavored greens. The tender tips and tops in early summer taste a little bit like cilantro. And here is a tasting experiment from the Forager's Chef. He says, here's the gist of the experiment. Blanch a handful of shoots for a minute or two in salted water, drain and eat one, maybe two. As you eat, notice the flavor and your reaction to it. Good, bad, interesting, nice texture, but too strong tasting all around, awful, etc. Next, take one of the same shoots and dip it or dress it with a condiment you like. He's been eating ramp salsa verde, and if you click on that, you'll get the recipe on things like this. But garlicky aioli, spicy mayonnaise, spiked with sriracha, or your favorite aggressively seasoned creamy or acidic saucy thing will do. As you eat the shoots dressed with a condiment, consider the flavor. I think you'll find it much more palatable and mild. And then here's a recipe that he gives on goldenrod shoots with sunflower vinaigrette. Now, how do we compare canadensis and odora? That's why I've combined these together here. Solidago odora, sometimes called anise-scented goldenrod or sweet goldenrod, and the Canadian goldenrod are both perennial and native to North America. By the way, all of the goldenrods are indigenous and native to North America. Now, these two share some overlapping medicinal applications as diuretics and anti-inflammatories, but differ in their specific traditional uses, chemical profiles, and sensory qualities. Odora is prized for its pleasant anise-like aroma when leaves are crushed, and that's a quick way to identify it. It does not grow as tall as the others, and when you crush the leaf, it's very distinctive, and it makes a very nice tasting tea, and it's one of the better ones for the digestive system. And here are some key comparisons, comparing traditional uses. You can pause this and read it yourself. Here are the reported effects, preparations and forms, potential side effects, scientific evidence, and some additional insights. And then we've got a few studies here on Solidago canadensis primarily. But I want to skip over now to preparation and dose. Now, this video goes into tincture making, infused vinegars, oxymels, and drying. It's harvested in full flower in late summer, taking the whole aerial herb from clean growth. Stems are quite fibrous. You could run those through a garden shredder or bunch and seccator into 3 centimeter sections, used in infusion or tincture form. Because of its good reputation as a vulnerary for injuries, ulcers, etc., you could prepare it in salves, washes, compresses, etc. Here are links to some instructions for making a tea, a tincture, a roundup of herbal recipes, and as mentioned before, it was proven that Solidago canadensis extract, obtained with 40% ethanol solution, had the most promising anti-inflammatory and hepatoactivity. As far as the daily dose, 6 to 12 grams of the comminuted herb prepared as an infusion. Fluid intake of at least 2 liters daily is recommended. Well, that is for a serious condition. That's quite a lot. I always recommend people start with very small amounts to test out their response. Some people react differently. Herbal medicine isn't one size fits all. What's good for one person may not be helpful at all to someone else. So start small and work your way up. As far as the standard infusion, 6 to 12 grams, 4 to 8 ounces of infusion 3 times daily. Tincture, fresh flowers, 1 to 2 in weight to volume in 95% alcohol. Dried flowers, 1 to 5 weight to volume in 50% alcohol. Although, as we've seen, while that's commonly the ratio that's given, 40% could be better. 2 to 4 milliliters 1 to 4 times daily. You can make a glyceride out of the dried flowers, and then of course we've got the topical use. But let's move on to cautions. We always need to look at cautions. Avoid using in deficiency cold conditions. It's contraindicated in cases of edema resulting from reduced cardiac or kidney function.